We're really excited to share with you all our St. John's journey from a finance and really a value picture. And I'm joined today with Jim Clark. He's going to be doing most of the fun talking today because he's probably the guy most listeners are here to listen to. But I did want to just introduce myself here. Rebecca Priest. I opened up our Penfield Homes 3+ years ago. I now oversee all of our skilled nursing operations at St. John's. And then I'm joined with Jim Clark, who's our Vice President of Finance and Chief Financial Officer. I would also like to reiterate that I think he's a finance genius and an all-around great guy to work with. We're from St. John's in Rochester, New York, and many of you have probably talked with either me or Jim or someone from the organization as you're planning or as you're working your respective greenhouse projects. But a little bit of background on our organization. We have 455 elders living in a traditional home right in a landlocked plot in downtown Rochester. And we're really aggressively pursuing what I think Rachel would call the legacy blueprint or a greenhouse alignment structure because we've seen such value in our small operation out in Penfield. And then we have a 20-person home, or 2 homes, Penfield site in Penfield, New York, which is a suburb. It's a standalone entity that's integrated right into a community. It's pretty fabulous. It's hard to describe, except for it's as if you're driving down your street and one of the houses on the street happens to be a greenhouse with a great backyard, and their next door neighbor is also a greenhouse. It's a really it's a very novel community generated project, and it's been pretty exciting to watch that part of that organization unfold. And then about a mile away, we have 440 people who live in senior housing, either in independent or assisted living, and that's part of our meadows. So we have a pretty big continuum of support in this organization and are really committed to providing the most incredible service, and I would say the most engaged elder service at the best value, which is what we're going to talk to you guys about today. So, as you're framing your value lessons that Jim's going to take us through, I want you to step it back, especially if you're finance or traditional operations people, and I want you to rethink all that you think you know or all that you think you need. The Greenhouse Project is a game changer for providers like us, and hopefully like you, who are courageous enough to change the game. But you have to really embrace this model, and that takes leadership. So it takes a leadership commitment that care can be delivered better by differently skilled staff, and that's that Shawazim, and supported by the clinical experts who oftentimes we tend to overly default to. So many of you guys might know I'm a huge literature fan, and T.S. Eliot might be one of my favorite poets. But he says, only those who risk going too far can possibly find out how far one can go. And when you think about the Greenhouse Project and you think about how do we make sure that our project actualizes the value that Jim and I are going to share with you that we know it can, it's going to take you to risk rethinking all that you think you know.
Okay. In the spirit of complete honesty, I appreciated it when Rebecca called me a financial genius, but there's probably a lot of geniuses who would be offended if they heard that. But I promise to give it my best. I've been in finance 30-plus years in a corporate finance setting, and then wow, it's been 18 months here at St. John's, and a lot of the principles that I learned 30 years ago really apply to this. And one of the fundamental principles is that the financials are more or less the after effect of doing things well. So in any organization, if you treat your customer correct and your employees correct, more than likely you're going to have good financial outcomes. In the case of St. John's and in particular, our greenhouse, we treat our elders very, very well. We have very successful employees. Our retention rate is effectively 100%. And guess what? The financial outcomes have flown naturally from that in two forms. Not only do we have the ability to generate money to put back into our organization, but also it's extremely predictable when we break things down to, in the case of Penfield, a 20-elder facility. And that predictability is something that is very important to anyone with a finance heart. In general, people in finance or administration or any place else don't like surprises. There are very few surprises with our greenhouse organization financially. Once we reach stability, which wasn't that long ago, we can predict the outcome month by month. And it's all a matter of just doing things the right way for our elders and our employees.
Well said, Jim Clark. So this is kind of the nice thing about St. John's is that we've got a traditional entity that has, for all intents and purposes, a relatively environmentally unchanged atmosphere. And in staff efforts, it's a relatively traditional way of using staff right now. Nurses, CNAs, clinical support team members, social work activities, that kind of thing. And then we have this juxtaposition of Penfield. And if leadership like Jim and I and you all listening really believe in the values of the greenhouse, and they happen to be very aligned with our organization, but the values of real home, empowered teams, meaningful lives, if we really believe in those values, we have to attain it for all of the people that we're serving and all of the staff that we're serving also. And Jim and I believe, and we've seen, that the variable cost savings and quality of staffing stability that we see in Penfield will not only continue in Penfield until the cows come home, but it will improve the resilience and agility of our entire organization in the midst of this kind of looming cloud of affordable care, of Medicaid managed care, of workforce drought. I don't know if any of you all are experiencing it, but I believe that you probably are. The pool of viable certified nursing assistants and even LPN candidates is shifting as education and the community shifts. And finally, what the community is demanding for is less costly and more impactful services. So as a service provider in Rochester community, we really believe that creating real home and empowered teams and meaningful lives has a cost impact that we can't ignore, and we're going to show you a little bit about that today. The nice thing is we have a pretty nice test pilot in Penfield, 20 people living there and about maybe 32, 33 employees. And then we have this mammoth organization in the city, which is 455 people and about 900 employees. And we can watch side by side how those costs are shaking out. And we can even draw some interesting hypotheses that we'll test out for you today a little bit, and then kind of revisit in a few months after we've really implemented a greenhouse-aligned structure in our 150 Highland Avenue setting down the road.
Great. So some of the things that are difficult to quantify, but we know that there's a financial benefit, is some of the clinical outcomes. So rather than just go through a significant number of calculations, we just did a side-by-side. Our 150 Highland Avenue facility, which is our large, I wouldn't call it traditional, but maybe more traditional facility versus Penfield. And you can see everything from our CMI scores, which is very important because one of the things I don't think we've mentioned yet is that the acuity level at Penfield is the same as it is at our large facility. As we grow into accountable care organizations and work with our hospital systems. We've been meeting a lot with various hospitals. The first question they always ask is, what's your rehospitalization rate? Our traditional facility has a pretty low rate. Penfield has an incredibly low rate. So they are very interested in how we're able to achieve this and how we will transfer that knowledge to our larger facility. Antipsychotic drug use is down. That's a benefit on two fronts, obviously, for the elder, but also our drug costs for Penfield are less on a per-patient basis than they are at Highland.
Can I talk for a second about quality?
Please.
Okay. So these three quality metrics, those of you who are operations will recognize that they're part of the federal QM process, and they're the ones that 150 Highland has struggled with over the last year and a half. And so I wanted you all to see, like, these are the quality measures that we've really struggled with. Here's those same quality measures that we've struggled with at 150 in Penfield, and then really show you how a universal workforce, a Shabazim workforce, the greenhouse model with coordinator roles, accountable nursing services, and following that model to the integrity of how the greenhouse model sets us up as a provider, as a doctor, to do so really drives down your quality risk, which from an Accountable Care Act is really advantageous for us as we look at partnering with some of our more acute providers locally. But it's also just a really compelling case. Antipsychotic use down 75% from admission. If you read between the lines on that, it's because Penfield is taking people who are unable to be supported in a more traditional skilled nursing setting. They have what I would call expressions of unmet needs. Some people might refer to them as behaviors with dementia, or they have challenging mental health comorbidities that are difficult to manage in a communal housing setting where you have very, I would kind of say, fragmented care. So we've been able to really ratchet down meds just by having people be well known and really sticking to the model. And then you can see kind of the implication of pain and pressure ulcers also, which both result in medication impacts, but also in a quality assurance program that's kind of unique.
So my cold financial heart also sees another benefit, and that is the ability to provide this higher level of clinical outcomes makes it a whole lot easier to attract people to the facility and to keep our occupancy rates up as high as 99+%. And the reason why I didn't say 100% is we do have a waiting list, but it does take some time to go through the waiting list and get people placed throughout the year. So if the other thing that I believe the Penfield model does extremely well, and the numbers vet this out rather nicely, and that is employee retention. In the Western New York area, and we're in Monroe County, to find a CNA, an RN, or an LPN is a real challenge. They're in huge demand. We have to differentiate ourselves in order to attract the best of the best caregivers. And by being able to retain folks, we're actually saving about $4,000 per employee per year. And you can see I quickly itemize that. Recruitment costs, overtime costs to cover a vacancy, and then the training cost associated with that is what adds up to the $3,937. The other soft or less tangible cost is the fact that our elders aren't seeing the same people day in and day out, the people that they've grown comfortable with. if we don't keep our retention rates high. I mentioned that the retention rate at Penfield is 100%. I'll never forget the first day I walked into Penfield, I thought, oh my goodness, how can we afford this? And today when I walk in, my feeling is, how can we not afford it? As I walk around and talk to our employees, they tell me it is the best job they've ever had because they are so connected with the folks that are there. Also, the fact that their lives are a little bit more predictable and they're able to be more responsive to elder needs, which change depending on who they're taking care of. So that engagement with the employees goes a long ways. It's as good as any other retention tool, whether it's economic or a reward type system. Just having that day-to-day engagement is really what's driving our retention.
Yeah, and I think you were pretty conservative with the $4,000 per person. I think many would argue it's much more costly to have turnover, but I think I like the way that you kind of said this is a number that we can touch, and you guys can kind of see who are listening, that even if it's $4,000 per employee, you can kind of get a sense in the replicability of that and why you would want to continue pursuing this is really about a model integrity issue with empowered teams. But if you're looking at empowered teams and you hire for fit and you get the right people who are coming to work in a different place and they come to work in a long-term care setting that's actually different as opposed to marketing differently or talking the talk of culture change, I think the reward is pretty tangible financially and from an experience standpoint.
It truly gives us a differentiator in the marketplace, in the caregiver marketplace. So one of the questions we typically get is, tell us about pay rates by position. This is our actual pay rate schedule that we use here in Monroe County. It is very similar to the other large skilled nursing facilities in the county. But we do try to differentiate the Shabazin at a different rate than a CNN, and also an ability to move up the rate scale depending on additional responsibilities they take on, and also just the pure cultural fit that they have with the overall organization. So, I'm a finance person. I had to have one slide that is just a ton of numbers. Otherwise, they kick me out of the club. But I'll kind of go through this slide very quickly. This is actual 2014 results by quarter for our Penfield facility, which is 20 elders. You can see $2.4 million in revenue. What I find very interesting about this is the variable expense, which includes everything from food, drugs, employee expense. I also have mixed in here, is so predictable. It's basically $448,000 per quarter, clicking off in a very, very predictable way. So from an earnings before income tax and amortization, it is a cash generating organization and has been. This is year 2 of the facility, 2014. We're into 2015 now with very similar results. And then when I add back the non-cash items, the taxes, interest, and depreciation, you can see operating income started off in a negative range, but in Q3 we did have to pay a one-time expense of roughly $150,000 for the facility. But other than that, it is slowly progressed into positive operating income. And that trend is continuing into 2015. I'm very happy to report. So imagine these type of financial statements broken down by 20 elder facilities. If you did have something that was out of whack, it would stand out extremely quickly, and you would be able to go address it in a very proactive manner. So that's another huge advantage in my mind of financial stability. So
I hate this slide.
Of course.
I know you like it, but I hate it because I think people look at it and see an operating income loss. And if you're smarter than me, you can probably understand why that is. Jim Clark does. But I want to just give a little bit of a plug here for Penfield's specific operations so that those who are listening, and you may ask us some questions about this at the end of our presentation too, but because we had to license Penfield separately, we have around $180,000 of imposed costs by our government on that in terms of having an additional, a segregated director of nursing, a segregated line for an administrator cost expense. We weren't able to leverage any contracts as a part of the existing operation because it was a separate entity, some board level expenses. So it's a uniquely licensed entity, but it is encouraging as we look into Q4 to see 20 people living in this entity generating $30,000 a month of positive cash to the organization because it's such a small microcosm of this business model. And as we move it to 150, the bigger organization, I think we're going to see some similar variable savings, which is what I like better.
Yeah, and one of the items, Rebecca's bothered by some of the non-cash items, which is fine. And one of the things that we were able to do with Penfield last year was renegotiate the mortgage and take advantage of the low market rates that are expected to continue at least into September this year, and then increment up in a very slow way. Another advantage of taking care of those types of items that are not day-to-day items is you can negotiate a Penfield greenhouse or any greenhouse with a bank in a traditional mortgage context. So a lot of these expenses will vary by region of the country. In Western New York, we are just incredibly blessed with paying taxes that are astronomical, and unfortunately that does flow through operating income.
This one I like.
Rebecca does like the next slide, which is the direct labor costs, and this is really the slide that sums up where we really have an advantage with the Chabazin model. In a traditional nursing facility, and again, these numbers are directly off our ledger, the nursing costs of $23 million for an average occupancy of 440, food of $1.4 million, environmental costs of $1.8. That includes everything from cleaning to grounds work, versus the nursing only costs, because we lump Chabazin, the nurses, any LPN costs directly into the $1,127,000. The resultant cost per patient or per elder is roughly $3,691 less. And this is where you really get a critical advantage. And I guess my one piece of advice would be that we have to know when to be corporate and when not to be corporate. There are some leveraging of contracts that we can do that helps Penfield be more efficient. For example, a very simple example is snow plowing in western New York, which is a very important thing. The same contract we use at Penfield we use here at the home. However, one of the other ones we came up with was, well, we can take advantage of our food contract. And in reality, that really wasn't an advantage because the people that were taking care of the elders, specifically the Shabazim, knew that if they went out and did the shopping themselves, they could actually beat our corporate contract. And they did. So you get this kind of organic, competitive nature going on how to best serve the elders at the best cost with the happiest employees. And that's another huge advantage. And the savings per day in direct labor costs, that's a real number, and that's something that is sustainable and will occur year after year. So we talked a little bit about this, the food costs. I think that's a fascinating story. When I first walked in to the organization, I thought, wow, we really have to leverage some of the corporate contracts we have, and the folks in the home were able to beat that cost. They clip coupons as an activity, which is something that really engages people into the overall mission of the organization.
They also, I'll tell a story. They recognized the food that came to the organization. So when you had like a purchasing contract of, let's say, I think they're called number 10 cans. I'm not a food person, but when you have number 10 cans being delivered to a house that you only need a half a cup of tomatoes for, the rest of that number 10 can gets wasted. So there was just a tremendous amount of excess waste because of how difficult it was for our vendors to find real, recognizable, household quality food. So the Shabazim said, this is ridiculous. The other thing that we've kind of gone back and forth on is supplies. So there are some benefits to having a purchasing agreement with a premier vendor or a preferred vendor, but we were paying, let's say, $3.50 for hand soap. And the Shabazim are like, we can go to the dollar store and get hand soap. This is ridiculous. And so we talked with them about the shared savings from that preferred vendor, and then we did our finance guy, Rob Earl, is incredible, and he did kind of a side-by-side comparison with them and said, okay, if you purchase this much from your vendor, you'll get a shared savings of this much, and it lowers your cost. But if you don't purchase that much, it actually makes more sense for you guys to go to the dollar store or Aldi or Walmart or wherever you're going and get the product that you like. So the Shabazim kind of have this sense of, we're going to beat the finances, and it really has developed a nice sense of healthy competition, not just between what finance predicts they'll spend, but also between each house. Like, hey, we're finding this at a better cost, guys. How are you doing? So I think it's kind of a nice, it's truly an empowered team.
Great. Pharmaceuticals pretty much speaks for itself. We've already talked about the improved clinical outcomes. I will tell you the property structure, we were able to negotiate a rate of just over 3% fixed for 10 years, which is something we were able to do just by bringing in multiple banks and having them take a look at how this really is the future of elder care. And a lot of banks just wanted to be part of it to get their name out there as an organization that supported what we were doing. So great rate, fixed, and it was less of a negotiation and more of a learning type of discussion that we had with, I think, 3 to 5 banks, we ended up in a very good place.
Because you're a financial genius. So I wanted to address in one of our slides why other providers might struggle. And I think there's a lot of people who are looking at look-alike products out there. I hate to call Greenhouse a product. I think that would probably be sacrilegious, but you know what I mean. So there are some key reasons, and if you haven't heard me say this strongly enough, or Jim reinforce it through his cold heart of corporate lens, is that you have to go all the way. The providers I've met who've really struggled have struggled because they are not leveraging the Chavez model, the coordinator role model. They're not keeping intact the premise that a self-managed work team can actualize what we're looking for. And so what happens is they don't offset clinical support team costs through fully operationalizing those roles. And then I think the other reason that I'm seeing people struggle is because there are some team dynamics that perhaps they're unwilling as an organization to bend on. Again, I think that a leadership alignment to say our mission is to provide real home, meaningful activities and an empowered work team, and we're going to go all the way. That makes for an organization to have to draw some lines in the sand. And I think if you've got a clinical team that's pushing for a clinical engagement of every social worker or every doc or every RN that you have to really kind of overly medicalize life in the greenhouse homes, I think you're going to struggle. But if you can really trust that self-managed teams with good coaching from those very smart clinical support team members can lead people to a great service model, you're going to see some great things come out. So, in summary, Jim Clark?
In summary, it's a very, very simple equation. Taking good care of your elders, plus taking very good care of the people who take care of your elders will equal a financially stable mission and attainment of that mission. There's a reason why we publish financial statements at the end of the month. The battle's over by then, and this addresses everything up front before any of the financials are printed on paper. So you can actually affect the outcome long before an income statement or a balance sheet